So Erickson is one of those things that when I talk about, everybody's like, oh no, not that again. I know I started learning about Erickson in my first classes on developmental psych, and I have relearned it for every certification exam since then. But Erickson, in a practical way, is super helpful for learning how to take care of kids. So excuse me, but we are going to talk about Erickson one more time. So your beginning is trust versus mistrust for infants. So basically, this goes till about 18 months, and what they're looking for is, are you going to meet my needs if I cry? So an infant cries, somebody responds, they get fed, they get held, they're comforted, and so that creates trust. And then if nobody does come or respond or take care of them, then they learn to mistrust their environment. So as infants get older, you may find infants that have not had that trust developed in them, and they don't snuggle in, they don't look for you, they don't make eye contact, because they have lost that trust versus mistrust. They just mistrust at this point. And that's super sad. So for infants, respond to them, talk to them, play with them, play peekaboo with them, develop trust and rapport with their parents. That's super important as we're caring for infants, that parents know that they can trust us, that they know that we care about their child. It is super stressful to have an infant in the hospital. I've been there. With newborn infants, your moms are still dealing with lots of postpartum hormone shifts and may be very tearful. Assume that this will happen. Please take care of your parents. Provide drinks, provide support, provide food, so that they can continue to care for their infants. So toddlers, autonomy versus shame and doubt. So toddlers are trying to figure out what they can do. I do it. They want to do what they want to do when they want to do it. And so when we praise them on what they're doing, we help them establish a foundation of self-belief. And if we discourage toddlers from doing things independently, they feel discouraged, ashamed, and doubtful of their ability. So what things can you let toddlers do? The caveat on toddlers is they are unpredictable and are essentially lemmings. So if a toddler can hurt themselves, they probably will. They will fall. They will pick themselves back up. They are a menace when connected to tubing. So you have to be really careful with your older infants and toddlers with oxygen tubing because of the risk of strangulation. So be super careful with toddlers, but try to give them jobs they can do. Give them choices. Do you want the blood pressure cuff on your leg or your arm? Learn what the things that they like, develop rapport with them. With toddlers, my best trick is to learn the theme songs of popular toddler TV shows. I used to have total ability to sing a bunch of them. My kids are teenagers now, and I don't have that anymore. But really, find the theme songs for the most popular shows on Disney and PBS, and you will have a friend for life. Distraction works tremendously well with toddlers, but again, treating them like people, giving them choices, empathizing, and just really trying to praise them for what they are doing. Preschoolers, initiative versus guilt. So we talk about toddler anthem as I do it. Preschoolers are I want to do it my way. Preschoolers are really, when they feel encouraged, they take the initiative to do things independently, and they feel a sense of purpose. If they're criticized or discouraged, they feel guilty. So preschoolers can be your best helpers. They can take the blood pressure cuff off. They could put their finger in a pulse oximeter. They can take the thermometer out of its holder. What can we let them do? Do you want to take your medicine in a cup or a syringe? A lot of preschoolers will like it better if it's not forced down them. Praise and reward are your hallmark for toddlers and preschoolers. Sticker charts. Every time you take your medicine well, or you drink another cup of something, or you do something else, I'll give you a sticker. So many stickers gives you a prize. Praise, high fives, all of those go a long way into being able to care for preschoolers and toddlers. collecting toys at Dollar Tree so you have things that you can give out, making sure you have stickers on your units, and encouraging parents to continue this when they go home. I always tell parents of kids who've had their tonsils out who are reluctant drinkers or struggle with medication or the medication's super terrible, buy out the Dollar Tree and reward. How positive can we make this experience for this patient? School age, industry versus inferiority. So in this stage, the child is becoming aware of who they are as individuals and their accomplishments, of what they can do. And if they feel a sense of accomplishment, they're competent and feel productive. And if they don't receive positive reinforcement for their accomplishments, they may feel inferior or incompetent. The school-age kids are still small children at heart. And so they need to know that they're being good or that they're trying hard. And this is where you really have to say, hey, you're doing a really good job. I know this is really hard. This may hurt, but this deep breathing is really going to help keep you well and make you go home sooner. They really need to hear why things have to happen or things are happening, and they need positive reinforcement. They may really side-eye you if you try to give them stickers. They may enjoy it. They may like privileges better, but really they are trying so hard. But don't forget that they may still be very scared and be struggling with this different environment. So adolescence, identity versus role confusion. During adolescence, they're trying to figure out who they are and to figure out what their priorities are for their adult life. They're trying to figure out how they're different than their parents. One of the things that you need to know about taking care of teenagers is that there comes a point where some of their information becomes private to them. So the easiest thing to do is to not divulge certain test results to parents. Let the provider do it. So those would include STD, pregnancy, urine or drug test results, things like that. Because the rules are just very complicated and the ages change some, it's just easier to just not give out that information and let a provider do that and have those conversations. I don't ask sensitive information from teenagers in front of their parents. I don't ask if they smoke, drink, or are sexually active if the parents are here. I may ask the parents to go to the gift shop or something like that, or try to catch them when they're out getting food if I need to ask questions. But I really try not to ask those questions in front of parents. One, you're not going to get a truthful answer. Two, if the patient does give you an answer, that may cause a lot of drama between them and their parents. So identity versus role confusion. Do keep in mind that these teenagers may look like they're almost adults, but inside they can still be very scared. One of the things that we often see with teenagers are the suicide attempts. And so making sure that you're aware of some of the angst that happens as teenagers. So young adulthood, I know here at Rockingham we do a lot of college age students, so we're going to talk a little bit about young adulthood, even though this is a pediatric session. Intimacy versus isolation. So this is 19 to 40, but these patients are identifying and building on their relationships with friends and families. And if you struggle with those relationships, they may feel isolated and lonely. So as you have patients who are newly 18, helping to remind the parents that these children have the right to decide who gets their health care information. So at 18, this is really up to the patient to determine who sees their chart and what information we give out. So always ask your patients before you're giving out information to their mom. It may seem really natural to tell the mom something, but once they're 18, that information is theirs to share, not yours. So making sure that they are on the list of people who can get updates, asking the patient to share what they want to share with that family member. And then if you're getting, for some reason, appendicitis seems to be a thing for college students. So if you have a patient whose family is coming in from out of town and they're heading to surgery, I try to have a conversation with them first. If your parents show up, what do you want me to tell them? Is it okay for them to be in your room? Things like that, so that it isn't a thing that just happens when they're in surgery. So again, remembering privacy when those patients, especially when those patients turn 18.